Hey guys, welcome back to my channel. So today I'm going to continue with the pharmacology 1/4 semester question and answers as per RGUHS. So I'll start from the first question, that is define agonist and give example. So agonist is a molecule that combines with a receptor on a cell to trigger the physiological reaction. So example is acetylcholine. And question number second, define antagonist with example. So the answer is antagonist is a substance which interferes or inhibits the physiological action of another. So antagonist is a drug that blocks the neurotransmitter, and alpha blockers, beta blockers and calcium channel blockers are the examples for antagonist. And question number 3, what do you mean by competitive antagonism? So the competitive antagonism is an antagonist binds with the same receptor as agonist. So if the log dose response curve with agonist is obtained in the presence of antagonist, it will be found that the antagonist has no effect of its own, and there is a parallel right yard shift in the dose response curve of agonist with no change in the shape, slope or maximum response. So the question number 4, explain about the first and zero order kinetics of elimination. So the first order kinetic, it refers to the chemical reaction where the rate of reaction depends upon the molar concentration of the one reactant, whereas the zero order reaction, it refers to the chemical reaction whose rate of reactant does not depend upon the reactant concentration. So question number 5, explain tolerance and dependence with example. So tolerance can be decreased in the responsiveness to a drug that following repeatedly to exposure, requiring an increase in the dose to produce the initial response. It is the most common response to repetitive use of the same drug. So the tolerance is widely occurring adaptive biological phenomena, and the example for the tolerance is analgesic and respiratory depressant effect. So the dependence. Dependence is a psychic and physical state of the person which is characterized by the behavioral and the other responses which resulting in the compulsion to take a drug on a continuous periodic basis in order to the expression and the effect at the same time to avoid the discomfort of its absence. So example, nicotine, morphine, cocaine and amphetamine. So question number 6, explain the significance of renal clearance, and in that the answer is glomerular filtration rate, thereby assessing the glomerular function, and renal plasma is also known as blood flow, which is not routinely performed. And question number 7, explain the significance of volume of distribution. So most of the drugs have an apparent volume of drug distribution where smaller than or equal to the body mass. For some drugs, the apparent volume of distribution will be several times from the body mass. In IV administration, the VD, that is volume distribution, is equal to dose IV divided by CP. So the question number 8, write a note on spare receptor. So the spare receptor, when a maximum response is elected by an agonist at a concentration that does not produce full accompany of the available receptors. So the spare receptors is also responsible for the tissue specific actions of agonist. Because the presence of the spare receptors increases the potency of an agonist, So the spare receptors is also complicated the analysis of partial agonist. And question number 9, write a short note on physiological antagonism. And the answer is, this is actually an agonist on the same tissue but produces opposite effect to that of the specific agonist. So it acts by the mechanism that are different from those of the specific agonist, and physical antagonism is quickly reverse the action of the specific agonist on the same tissue. By the question number 10, write a short note on non-competitive antagonism, and it does not bind to the same receptor site as an agonist, where the inhibition cannot be overcome by increasing the agonist concentration, which is irreversible. So the agonist maximum response will be depressed, and the agonist dose response curve will be shifted to the right yard, and agonist potency may or may not be developed. And question number 11, write a note on idosynchronicity. So drug idosynchronicity refers to untold reaction to drugs that occurs in a small fraction of patients and have no obviously relationship to the dose or the duration of the therapy. Question number 12, write a note on addiction. So the addiction is a compulsive nature of the drug which is used to despite physical and physiological harm to the user and the society, and includes both licked and illicked drug, means legal and illegal drug. And question number 13, write a note on tolerance. So you have to refer question number 5. And question number 14, write a note on dependence. Even this you have to refer question number 5. And lastly, question number 15, write a note on tachyphylaxis. So the tachyphylaxis occur when a medication suddenly provides a lessened response or benefit than it once did. So it refers to the rapid development of the tolerance when doses of the drug repeated in a quick succession. So the result in the marked reduction in response. This is usually seen with indirectly acting drugs such as ephedrine, triamine and nicotine. So here we have completed the 2 marks of pharmacology 1 4th semester. So tomorrow I am going to continue with the second unit of pharmacology, that is general pharmacology. Please do like, share and subscribe to my channel. Thank you very much.